Popliteal pterygium syndrome, PPS, is a very rare condition you are born with. It creates a thin, web-like skin fold behind the knee and can also affect the mouth, teeth, and genital area. Think of it as a tiny ribbon of skin that stretches across the back of the knee, making the leg feel a bit stiff right from the start. PPS happens because of a change mutation in a gene called IRF6. The change can be passed from one parent to a child in an autosomal dominant way, which means if a parent has the altered gene, each child has about a 50% chance of inheriting it. Even if a parent looks normal, they can still carry the hidden change and pass it on. A web of skin behind the knee that limits bending. A club-shaped foot. A split lip or palate. Sometimes extra skin or folds on the genitals. For example, if you ask a child with PPS to try to touch their toes, they may stop early because the knee cannot bend fully. Doctors usually spot PPS by looking at the physical features, and then confirm it with a blood test that checks the IRF6 gene. Treatment is personalized. A surgeon may cut the web like opening a zipper to improve knee movement, dentists help fix cleft lips or palates, and physical therapists work on stretching exercises. Regular follow-up helps keep the child growing strong. Because PPS is genetic, it cannot be stopped like an infection. However, families can lower the surprise factor by seeing a genetic counselor before pregnancy. The counselor can explain the 50% risk, offer DNA testing of the parents, and discuss options such as prenatal testing or pre-implantation genetic diagnosis for future pregnancies. New research is finding more tiny changes in the IRF6 gene that cause PPS, which makes genetic testing more accurate. Surgeons are also using modern tools such as tissue expanders and 3D printed braces to make the web cut surgery safer and the recovery quicker. Scientists are exploring gene editing techniques that could, in the future, correct the mutation before a baby is born.